Welcome to this special Mesobook presentation focusing on the pioneering work of Dr. David Sugarbaker and the essential steps for managing insurance and legal help in 2026. When we talk about mesothelioma treatment, the name Dr. David Sugarbaker stands out as a titan in the field because he revolutionized the way the medical community approaches this aggressive cancer. Known for his development of the extrapleural pneumonectomy and his dedication to the multimodality treatment approach, he gave hope to thousands of patients when few others could. Today, we are exploring how his legacy continues to influence modern surgical techniques and how you can afford these life-saving procedures for proper insurance navigation and legal compensation. Dr. Sugarbaker believed that mesothelioma required a specialized aggressive strategy involving surgery and chemotherapy and radiation. This comprehensive care is often referred to as the Sugarbaker protocol, and it remains the gold standard for eligible patients seeking long-term survival. However, these advanced treatments are incredibly expensive and requiring specialized surgeons and intensive hospital stays, which is why understanding your insurance coverage is the first major hurdle for any family. Many private insurance plans have complex requirements for out-of-network care, especially since mesothelioma specialists are often located at specific centers of excellence across country. Our guide explains how to advocate for yourself with insurance providers to ensure that a referral to a top-tier specialist is covered under your policy. We also look at the role of Medicare and Medicaid in 2026 and how supplemental policies can fill the gaps for travel expenses and specialized medications. Beyond insurance, there is the critical world of legal help, which serves as a financial lifeline for families pursuing the treatments pioneered by Dr. Sugarbaker. Because mesothelioma is caused by asbestos exposure, the companies that manufactured these materials are legally responsible for your medical bills and your pain and suffering. Filing a legal claim is not about being litigious, but about securing the resources necessary to access the best doctors in the world. Many families worry that the legal process will be too taxing during a medical crisis, but modern asbestos litigation in 2026 is designed to be streamlined and patient-focused. Specialized attorneys can handle the entire process from identifying the job site where exposure occurred to filing claims with asbestos trust funds without the patient ever needing to leave their home. This financial recovery can cover the high deductibles and the co-pays and the experimental treatments that insurance might initially deny. It is important to remember that Dr. Sugarbaker always emphasized the importance of early intervention, and the same applies to your legal and insurance strategy. Waiting to seek legal advice can lead to missed deadlines and lost opportunities for funding that could pay for your care. As we look at the medical landscape today, we see that plural mesothelioma treatments have evolved, but the foundational principles of aggressive surgery and localized therapy remain vital. The cost of these surgeries can easily reach hundreds of thousands of dollars, but between specialized insurance navigation and the billions of dollars available in asbestos trusts, no family should have to choose between their bank account and their life. This video guide provides the step-by-step breakdown of how to coordinate your medical team with your legal team to ensure a seamless flow of information and support. We discuss the importance of keeping detailed records of every consultation and every treatment session, as these medical records serve as the primary evidence for your legal case. We also highlight the top medical centers in 2026 that continue the work started by Dr. Sugarbaker, providing you with a list of experts who specialize in thoracic surgery and oncology. Remember that you have the right to a second opinion, and you have the right to seek compensation for the negligence that led to your diagnosis. The legal system has set aside these funds specifically for people in your position, and accessing them is a standard part of the modern treatment journey. by combining the medical brilliance of the Sugarbaker legacy with a proactive legal and insurance plan, you are giving yourself the best possible chance for a positive outcome. We encourage you to use the resources linked in this video to find qualified asbestos attorneys who offer free consultations and understand the specific medical needs of mesothelioma patients. Your health is the priority, and the financial support available through legal claims is the engine that allows you to focus entirely on recovery and spending time with your loved ones. Thank you for joining us for this in-depth look at Dr. David Sugarbaker and the path to comprehensive care, and we hope this information empowers you to take the next step in your journey toward healing and justice. Navigating a mesothelioma diagnosis requires a dual strategy that addresses both the medical urgency and the financial reality of long-term care in 2026. Today, we are honoring the groundbreaking contributions of Dr. David Sugarbaker while explaining the critical intersection of insurance protocols and legal recovery for families. Dr. Sugarbaker was often called the father of mesothelioma treatment because he refused to accept the status quo and instead pushed for aggressive surgical interventions that extended the lives of thousands. His work at Brigham and Women's Hospital and later at the Baylor College of Medicine established a blueprint for how thoracic cancers should be treated using a team-based approach. For a patient today, this means seeking out a multidisciplinary team that includes surgeons and radiologists and pathologists who all specialize in this rare disease. However, the cost of accessing a surgeon of this caliber can be astronomical, which is why your insurance and legal strategy must be established immediately upon diagnosis. Let us start with the complexities of health insurance in the United States. Mesothelioma is a specialized field, and most general oncologists do not have the experience necessary to perform the complex surgeries like pleurectomy or decortication. This often means traveling out of state to a designated cancer center of excellence. Our 2026 guide covers how to file for an out-of-network exception with your insurance provider so that your treatment at a specialized facility is billed as a network. This single step can save a family hundreds of thousands of dollars in out-of-pocket costs. We also discuss the importance of the appeals process if your insurance initially denies a specific surgical procedure or a new immunotherapy drug. Insurance companies often use automated systems to flag high-cost treatments, but a dedicated patient advocate or a specialized legal team can help you overturn these decisions. Moving into the legal aspect, we must address the source of the funding for these treatments. Because mesothelioma is almost exclusively caused by asbestos exposure, the legal system has created a unique pathway for compensation that bypasses much of the traditional court stress. There are dozens of asbestos trust funds with billions of dollars specifically earmarked for medical expenses and lost wages. When you hire a specialized mesothelioma lawyer, they are not just looking for a settlement, they are looking for the funds to pay for the legacy of care that Dr. Sugarbaker championed. This financial support is what allows a patient to afford the travel to Houston or Boston or New York to see the top experts in the world. In 2026, the legal process has become even more data-driven, allowing attorneys to quickly identify which asbestos products were present at a shipyard or a power plant or a construction site from decades ago. This means the burden on the family to provide proof is significantly reduced. The legal team does the heavy lifting while the family focuses on the medical appointments and the recovery process. We also want to highlight the importance of clinical trials, which Dr. Sugarbaker often integrated into